Between the dicing, grating, cutting, mixing, chopping, and sizzling, this looks like a regular cooking class.
Go ahead and get another cup measure.
But these are KU Med School students, and this class is the brainchild of University of Kansas Health System allergist, Dr. Marissa Love.
You might be wondering, well, why is an allergist doing cooking classes?
Over the years, Dr. Love says she noticed a common thread among her food allergy patients.
Many of my patients were underserved in low-income communities, didn't have access to a big box grocery store or a specialty grocery store. Food insecurity and food allergy double burden or food restriction double burden is significant.
These will be perfect.
Most of them couldn't afford, let alone find, safe and nutritious food, and were overwhelmed when it came to creating the meals themselves.
The cost of specialty foods is astronomical compared to, regular foods that don't have gluten-free or milk-free or peanut-free or top 9 free.
That looks so good. That looks so good.
So Dr. Love reached out to dietetics and nutrition chair at KU Med, Professor Debra Sullivan, for help developing a culinary medicine class.
It's just a great collaboration.
The goal? Educate future healthcare workers who will soon have patients of their own with similar struggles of accessibility and affordability, allergies or not.
But as soon as you hit C, pull it.
Okay.
They're going to be dealing with patients that have diabetes, that have obesities, that have heart disease, high blood pressure.
It's just important for students to have that lived experience so that they can better relate to their patients and be able to counsel their patients about the importance of healthy cooking and how to get nutritious meals without sacrificing taste.
Each course is 3 days long, but Dr. Love has big dreams to one day expand and develop a culinary medicine center for people across the community so they can all learn how to nurture themselves and feed their families safe, nutritious, and affordable meals.